Taking care of a premature baby can be overwhelming, but with enough knowledge, it can be made easy. Let's talk about it. A premature baby is a baby born before 37 weeks of pregnancy, and the way they are taken care of is not the same way term babies are taken care of. So I congratulate any mother that has a prime baby. You're a superhero. Those little human beings are not very easy, but it can be done. And today I want us to discuss how it can be made easy step by step. So we are going to talk about it in this way: hygiene, what you need, and what they have to feed on. Yeah, I'll break it down in that way. So what you need to start with is help, the best help. So at PragmaMom, we have nurses and midwives, professional nurses and midwives that offer quality care to newborns and premature babies the right way. If you do not have help as a prime mother, you're going to get overwhelmed because they demand for more time, for more care, for more feeds, for more changing, and you can't do it alone. And sometimes our husbands are too busy looking for money to sustain the family. So win yourself a PragmaMom sidekick and make the journey easy. So after getting the best help, you sit down and have a routine for this baby. Having a routine makes everything easy and you have something to follow. So prime babies feed 2 hourly. We change them 2 hourly. We check their vitals depending on their health state, but it is between 30 minutes and 2 hours. So you have it with your nurse in writing and you clearly know that at this time, my child is going to feed. So you're not going to be all over the place and okay, you're like, should I feed them now? Should I do this? You have to have a guideline and you're like, okay, this comes after this and this and this. And also them having a routine gives them a more relaxed mind because they're going to have time to sleep and then you come and change them and then they feed and they sleep again. But if you're doing things at different times, then it is also not nice for them. So after having that, we are going to talk about the hygiene. So prematures are so bad on unhygienic things because their immune system is too low. They are born too little and too soon, so we must be as hygienic as we can, starting from our hands. If you can, and you can be recommended 2 gloves that are not irritable, put on gloves in the very, very early days. Put on a mask because we don't know what you have. You might have a virus or something, a cold, a flu, and the moment it is passed on to this child, things are different. Don't allow visitors yet, unless you've monitored your child and they're now at least 2 to 3 months. But them being a month, they're just discharged from the hospital and people are flooding into the home. It is not right. Yes, it is a moment of celebrating and everything, but let us wait for the baby to grow a bit, their immune system to get stable, and we can have people in. But for the people in the house, we should be as hygienic as we can. Wash hands, put on masks, cover our hair, put on very, very clean clothes. If we can also put on aprons. If you're carrying the baby, put a clean cloth on yourself. Don't put them directly to your clothes because we don't know how clean it is. Then how we feed them strictly, if you can, if the mother is available, please breastfeed your prime baby. Breast milk does a lot for their bodies with growth, with sleep, with treating them. Breast milk is gold, as we all know. So if we can, let us do away with formula unless the mother is not around or it has been recommended in any way, but it should be the last resort. So we feed them 2 hourly. There are bottles that are recommended and they are strictly for prime babies. They have a very small teat. So we can start with those. If we are to use a bottle, then train them how to feed slowly. It might be hard, but we shall get there. So these are some of the things that affect prematures. Usually prematures have issues with the digestive system because it is just figuring things out. So they tend to get constipation. But there are medications that are recommended in hospitals. Call your gyne, ask them, what should I use? There are different exercises that I'll be sharing. If you follow to watch the next video, I'll be sharing different exercises on how to relieve prematures and make their digestive system better. So if we do this, we can have a peaceful journey with prime babies. Mothers out there, like, follow, and subscribe.